This is Dakota News Now.
Good evening, I'm Andrea Anderson.
I'm Brian Allen. The start of the new school year for many, believe it or not, is only about a month away.
And while it's important for families to make sure that their children have everything they need academically, their health going into the year is also something to keep in mind. Cooper Seamert joins us with this health alert here at 6. Cooper.
Brian and Andrea, along with the needed school supplies to start the new year, immunizations are also something to keep an eye on. The South Dakota Department of Health requires updated series of shots for children at different ages, and now might be the time to schedule an appointment if needed. Just as important as having the right class schedule, books, and materials for a new school year is making sure children have updated vaccinations before heading off for their first day. The South Dakota Department of Health requires a number of vaccinations for children entering into school for the first time. Those include shots for DPT, polio, measles, mumps, and rubella, as well as chickenpox if a child hasn't had the virus yet. Tdap and meningococcal vaccines are also required for South Dakota students going into the 6th grade and are at least 11 years old. Sanford Health pediatrician Dr. Jennifer Hagar says these vaccinations are important in protecting children against rare diseases that oftentimes carry dangerous side effects.
A lot of times we don't know a lot about these illnesses because we're vaccinated and we've never experienced them. So just getting some information, knowing really what you're protecting yourself against can go a long ways in feeling comfortable with them.
And they're always happy to talk with families about getting updated and the information they need.
These vaccines are safe, they're effective, and they prevent really devastating disease. And so we recommend them for our patients and are always happy to talk through what they're preventing, what they're protecting against, and the risks and benefits.
And Hagar says the COVID-19 pandemic set a lot of children back on their checkups, especially for middle schoolers. So speaking with the doctor before the beginning of the school year on what children may need to catch up on is something they recommend.
During COVID, we really saw a lot of people not make their yearly checkups. And so surprisingly, I've been finding, a 7-year-old who's not up to date, though the family would hope to otherwise have them up to date.
Hagar says now is the start of a busy time for them as families schedule appointments before the new school year. So she says it's a good idea to get the ball rolling and schedule any immunizations or checkups now before it's too late.